Chapter 23 looks at the urogenital infections. So we'll look at infections involving the urinary tract as well as the reproductive system. So we'll start out with cystitis, which is a bladder inflammation or bladder infection. You'll notice with the signs and symptoms here, they all end in urea, indicating urine. So we have dysuria, pain, pyuria, pus, and hematuria, blood. Now, you may not have a patient that has blood in their urine that is visible, but once it's tested with the urine dipstick, then microscopic amounts of blood may show up. There are a lot of different pathogens that can cause bladder infections. For women, number one, E. coli. And this is because the opening to the bladder, the urethra, the opening to the urethra, that the tube that leads to the bladder, in women is very close to the anus. So bacteria from the anus, from feces, can make their way up to the urethra, particularly if you have an individual who doesn't wipe the correct way, they wipe back to front, then that can move bacteria up closer to the entrance of the urethra, and then that can make its way up through the urethra into the bladder and even on up to the kidneys. So you have to be really careful, have good personal hygiene. So pyelonephritis and glomerulonephritis both affect the kidneys. Typically, pyelonephritis occurs when bacteria has spread from the bladder up the ureter to the kidney. Glomerulonephritis is a little bit more specific. This is when the nephrons are damaged, which can lead to really a decline in overall kidney function. Leptospirosis is kind of a weird one. Don't really see it much in the United States. Occurs more in tropical areas, so we'll see some in Hawaii, some in the southern United States, but we really don't see a lot of this. Can be spread through the urine of infected individuals, can lead to jaundice, which is the accumulation of bilirubin in the skin that's not being broken down, fever, headache. And again, one that we don't really have to worry about so much. Leptospirosis is caused by Leptospira interrogans, and it takes its name because it's a spirochete that kind of coils into this shape that resembles a question mark. So that's where it got its name. Now we have something called NGU. This is non-gonococcal urethritis. So this is inflammation of the urethra, not related to an infection by Neisseria gonorrhea. So this is non-gonococcal urethritis. Don't typically see this much in women in terms of symptoms, but for men, it can cause a purulent discharge and dysuria or pain upon urination. Can lead to other problems because it can spread, can lead to PID or pelvic inflammatory disease, and salpingitis. Salpingitis is inflammation or infection of the fallopian tubes. And then epididymitis and prostatitis, so that would be inflammation of the epididymis or inflammation of the prostate in men. So when we talk about non-gonococcal urethritis, a lot of times we may be referring to an infection with chlamydia trachomatis, which is transmitted sexually, of course. We also can have mycoplasma or ureaplasma species that cause this, which are members of the normal flora. Again, just taking advantage of the situation, getting into an area where they don't belong, and then causing some problems. So now getting into our sexually transmitted diseases or sexually transmitted infections, we've tossed around a few different names for these. They were formerly known as VD, venereal diseases. Then we started calling them sexually transmitted diseases. Now the more politically correct term is sexually transmitted infections. The biggest issue with sexually transmitted infections is antibiotic resistance, which we'll get to here in a minute. So our first one that we have here is bacterial vaginosis. Now, bacterial vaginosis doesn't have to be sexually transmitted. It can be an opportunistic infection. The vagina, we know, is full of different types of bacteria, and if one of these bacteria, particularly Gardnerella species, if it starts to grow out of control and kind of take over, then it can lead to BV. A new sexual partner can often trigger BV because the male penis is going to have different bacteria on it than what's in the vagina. So the penis can introduce bacteria into the vagina that would normally be there. So it can be, but it doesn't have to be a sexually transmitted infection. Maybe asymptomatic, but a lot of times the symptoms are going to include a discharge, an odor that's associated with it, pain or itching. Treatment can be oral antibiotics or vaginal creams administered at night can take care of the issue. So when we look at bacterial vaginosis, you see it's the most common vaginal condition in women ages 15 to 44. About 30% of women can have it at any given time. And you see there, women who have not had vaginal, oral, or anal sex can still be affected. So it can occur in women who are not sexually active. But we group it here because it can be transmitted sexually. Okay, so diagnosis of BV is kind of a varied method. You have Amsel's diagnostic criteria. You see there 3 of the 4 are met. White to yellow discharge, a fishy odor, especially when a potassium hydroxide solution is added, pH greater than 4.5, or the presence of clue cells. So here's a picture of the so-called clue cells. So the epithelium in the vagina is the same as that of the mouth. So if you've done, cheek cells, if you've taken your cheek cells and you made a little smear, typically we use a blue stain. So these little cells may appear blue. They kind of look like blue fried eggs. In this case, the different stain that they use, they're pink. Okay. So these are the epithelial cells. And so you take a smear of the vagina, you get these cells, you put some sodium chloride or a salt solution on there, and the bacteria may completely occlude or cover an epithelial cell. So that's what you're seeing there on the left. So all of these little purpley bacteria here, they have like completely covered up this cell. And so it's called a clue cell, so named because it gives a clue to the diagnosis. Now getting into gonorrhea, humans are the only reservoir of this one. So, again, something we could get rid of if people would practice safe sex. This is one that we have a huge problem with in terms of antibiotic resistance because people don't take their recommended dosage and they start to have these antibiotic resistant strains. So here is a smear, and you've got these really large cells. Those are white blood cells. And then these little cells here where you see 2 of them kind of touching together, those are characteristic of Neisseria. Neisseria exists as a diplococcus. So you will see the 2 little cells stuck together. Gonorrhea rates by state. You see the South is particularly hit hard here. And what I'm going to show you these for every sexually transmitted infection that we go through. I want you to pay close attention to Washington, D.C., and there will be some bonus points opportunity in it for you at the end. See there we had a spike kind of in the mid to late 70s into the 80s, kind of filtered down, trended way down, and now we're starting to peak back up again. The South reigns supreme here. We have the highest case rates. You see for females, the 20 to 24-year-old age group is most affected. Same thing for males. Here's our antibiotic resistance. And what we're talking about here is elevated mics, so elevated minimum inhibitory concentration. So, when we did our lab a couple weeks ago, we looked at specific doses of the antibiotics. And so what this is showing you is that over time, it takes more and more and more azithromycin to treat the same amount of bacteria, same amount of the gonorrhea bacteria. So untreated gonorrhea can lead to PID, or pelvic inflammatory disease, which basically can cause abscesses all throughout the female reproductive tract. And if it gets serious enough, it can lead to sterility. So chlamydia is pretty similar to gonorrhea. They cause a lot of the same symptoms. However, we don't see as much antibiotic resistance with this one. And it is much more asymptomatic than gonorrhea is. It is the most common notifiable disease in the United States. Gonorrhea is second. So this is looking into the vagina through a speculum here. And so you can see the redness and the discharge that's associated with chlamydia. So this would be vaginitis. So you see the case rates of chlamydia are almost double that of gonorrhea. Women, more reported cases than men. Women tend to be more symptomatic with this one. Again, the South, highest number of cases. 20 to 24-year-old females have the highest case rates. Same thing for males. Syphilis. Syphilis has been around forever. It's one that we have known about for a really long time. Fortunately, syphilis can still be treated by penicillin. We don't tend to see much resistance with it. It cannot survive outside the human environment. We have never really been able to culture this one. We've never been able to study it because we can't get it to grow outside of the human. Men, much more likely to have syphilis than women. There are three phases of syphilis: the primary, secondary, and tertiary phases. So the primary phase starts with a sore called a chancre. Forms at the site of infection. For males, this is most often on the penis, but for females, it's typically inside. It's typically on the vagina or the cervix, and so they may never know that they're infected because they don't see this sore. Stays there for a month or so, then goes away. And then we get to the secondary phase. The pathogen is now in the bloodstream. It's going throughout the body, and it causes this widespread rash that is set apart from other rashes because it occurs on the palms of the hands and the soles of the feet. And that's not typically seen with any of our other rash diseases. And during primary and secondary stages, it can be treated. Now, the tertiary stage, you see there, results from a hyperimmune response, occurs in about a third of original cases. So the person's fine, they live their life, and then all of a sudden, many years pass, and they develop this tertiary syphilis. Basically, the immune system goes into hyperdrive and tries to do whatever it can to get rid of this pathogen, get rid of these antigens, get rid of these antibodies. Can affect the entire body, And typically what we see with it is it leads to dementia. So it starts to affect the brain and leads to dementia. So Treponema pallidum is a spirochete, causative agent of syphilis. Here's a chancre. So this one happens to be on the outside. So this is just this sore that forms, not painful. Here's one on the penis. Here's the rash that's associated with secondary syphilis. So again, occurs on the palms of the hands. We don't really see that. And each one of these little lesions is going to be filled with bacteria. Now, once it progresses to tertiary syphilis, again, it can affect pretty much any part of the body, but it can affect the skin and the joints. And these are called gumas. And basically, they're large lesions that can be external like this, or they can be internal. They're very, very painful. And really, there's nothing that can be done at this point to treat it. You see the case rates of syphilis much lower than that of gonorrhea or chlamydia. Again, 20 to 24-year-old age group, and you can see this one's starting to trend upward again for females, but for males, the highest age group is 25 to 29. Syphilis can be linked to congenital syphilis. You see there's 64 syphilitic stillbirths, 13 infant deaths. This has increased. And you see there increase in congenital syphilis parallels increases in primary and secondary syphilis among reproductive aged women. So here's the blue is your congenital syphilis cases, and the line is your primary and secondary syphilis rate. So as those start to trend upward, then our congenital syphilis rates start to trend upward. So congenital syphilis can lead to several birth defects. One of these is called saddle nose. You can see the nose is pretty much flat, doesn't really stick up off the body, which can lead to breathing problems. Then you have something called saber shins, where the shin bones, the tibia, are curved. And then Hutchinson's teeth is another congenital defect. So there are a lot of different defects that can result from that. So now moving into viral infections, we have genital herpes, herpes simplex type 2, and just like all the other herpes viruses, this can remain latent. It's more common in women than it is in men, produces blisters very similar to cold sores that we've already talked about, but it produces them on the genital area. So here are some lesions on the penis. So when we look at the case rates of herpes have stayed pretty steady, maybe trending a little bit downward in the overall population. You can see non-Hispanic Black individuals have almost double the case rates as the total population. Genital warts are caused by human papillomaviruses. We've already talked about these, but these are we've already talked about human papillomavirus in terms of warts that occur on the body, but genital warts are caused by specific strains of HPV. Of course, there is a vaccine now, the Gardasil vaccine. There's the Gardasil 9 and the Gardasil 13, which protect against 9 strains and 13 strains respectively, that are most linked to cancer. It is the most common sexually transmitted infection. You see there about 79 million Americans are currently infected with HPV, and there are 14 million new cases each year. So here is the male penis with genital warts. Warts in the female. These tend to be on the outer surface. So women who go for their yearly exam, they get what's called a pap smear, and this takes a scraping of the cervix. and you're looking for cancerous changes. And so this would be an example of a precancerous change. So you've got normal cells here on the left, okay? And again, they look very similar to those vaginal cells that we were looking at, kind of fried eggs. And on the right, you have HPV infected cells. Notice that the cells themselves are larger, but notice how much larger the nuclei are and how deeply stained they are, how pigmented they are. This is called hyperpigmentation. Notice also that all of these cells are kind of stuck together. Some of them have double nuclei. This is an indication that this individual is infected with HPV. And HPV can lead to cervical cancer, anal cancer, oral cancers. So if we look at prevalence here, again, the 20 to 24-year-old age group for females being a little surpassed by the 25 to 29-year-olds, trending downward in the 15 to 19-year-old group for females. And then when we look at males, we see the highest in the 25 to 29-year-old and really very low prevalence in the 15 to 19-year-old age group. Now we get into our fungal infection here, vaginal candidiasis, or what we would commonly refer to as a yeast infection or a vaginal yeast infection. We looked at thrush before, which was a yeast infection in the mouth. Same pathogen here, Candida albicans, typically immunosuppression. You have yeast that normally live in the vagina. They're kept in check by bacterial populations, but a woman, she takes antibiotic, kills off some of those. Now the yeast can start to grow and lead to infection. Can take diflucan as a precautionary measure, as a prophylactic if you're going to be on broad spectrum antibiotics. There are a lot of over-the-counter medications, but it's important that a woman get a proper diagnosis because yeast infections can mimic things like bacterial vaginosis and trichomoniasis. So it's important to get a proper diagnosis before self-medicating. Yeast infection, again, here, this is a picture of the vagina. You'll notice the redness here, but you'll also notice the discharge. It's very thick, very clumpy. That is indicative of a yeast infection. That's our only fungal infection of the urogenitary tract. Gosh, I can't talk today. So our only protozoan pathogen is Trichomonas vaginalis, which causes trichomoniasis. May be found among normal microbiota, but more than likely it is sexual contact. Can be transmitted by fomites, so this one's the only one. All these others you're not getting from the toilet seat. This one, maybe. But typically it's contaminated towels or clothing, can survive outside the body. So this one could potentially contract from a non-sexual transmission. So with women, vaginitis, a purulent, which is pus-filled, odorous discharge, painful urination. Most of the time for men, it is asymptomatic. It is the most common protozoan disease in our developed nations. So Trichomonas vaginalis, it is a protozoan. You can see it compared here. These little specks are bacterial cells, and then you've got the Trichomonas vaginalis there. It has a single flagellum. And here is, again, a view of the vagina. Notice how red, this is much more red than we saw with chlamydia or with yeast infections. And notice the discharge here is kind of bubbly, very pronounced discharge. I've been told from healthcare providers that trichomoniasis is often diagnosed by its smell alone. You see it's relatively rare compared to other types of vaginal infections. All right, so if you were paying attention to the data that I was showing you for Washington, D.C., I made sure to pause on those slides. I want you to email me and tell me what you observed about the rates of gonorrhea, chlamydia, and syphilis in Washington, D.C. compared to the rest of the nation.